Hello, and welcome to the Cycle Endometriosis podcast, where we will delve deep into experiences, challenges, and triumphs of those navigating a life with endometriosis. Join us as we share the stories of resilience, offer insights from experts, and foster a community of support for those affected by this often misunderstood condition. Whether you're newly diagnosed, a seasoned warrior, or seeking understanding, I hope this podcast is here to help empower you and uplift you on your journey. Tune in as we break the silence, shatter stigmas, and amplify the voices of the endometriosis community. Medical disclaimer: this podcast is not intended for the purpose of providing medical advice. All information, content, and material of this podcast is for informational purposes only and is not intended to serve as a substitute for the consultation, diagnosis, and/or medical treatment of a qualified physician or healthcare provider. Thank you so much for being here, and now on to the show. Hello, everybody. Welcome to this month's episode of the Cycle Podcast. I have a special guest today. I always have special guests. Everyone that's on the show is very Dr. Maggie Abrams is joining us today. She is a board certified in women's health and visceral manipulation specialist. Can't wait to learn about what all of that means and other certifications that you have. Welcome, Maggie. Thank you so much for being here. How are you today?
I'm doing great. How are you, Melissa?
I'm good. I'll tell everyone when I'm recording this, I'm a little jet lagged, so I might not be as sharp as normal, but we're going to get through it because that's what we do. So Dr. Maggie, tell us a little bit about yourself, what you do, maybe just a little bit about maybe personal life, whatever you want to share. We want to get to know you a little bit.
Yeah. Well, as you said, I'm a doctor of physical therapy. I'm board certified in women's health. I'm also a health and wellness coach. I live in Columbus, Ohio with my husband and 2 kids and 2 cats. And I'm with you on the little fatigued. I was up pretty early with a kiddo this morning, so a little drowsy myself.
Yeah.
So I reached out to talk about visceral manipulation. So when I was undergoing my training in women's health, I stumbled upon visceral manipulation, which is a treatment technique, a hands-on manual treatment technique that assesses the mobility of how well organs can move in the body, and then uses gentle, specific techniques to improve their mobility. So I sought out a course and immediately was hooked on it. It really felt like the technique mirrored my values and how I approach the body. The school of training I went through, the values are very much precision and gentleness as opposed to force, very much working with the tissues. So lots of respect and love for the body as you're working with it. So I pursued extensive training in visceral manipulation while going through my women's health training. And in the clinic, I was starting to use it. So here I'd like to just jump over and just talk about the research on visceral manipulation for endometriosis. So truth be told, there's just not a lot that exists. Big surprise there. And then the research that does exist, the subject numbers are very small, right? So it's hard to conclude powerful statements from it. But overall, there aren't adverse effects. The only adverse effect I've ever seen reported was fatigue. There are some other risks that I'd like to talk about later, but for those studies, only fatigue. And then in the study that looked at visceral manipulation for deep infiltrating endometriosis, specifically with bowel involvement, those patients, 80% of them that were treated experienced improvements in bodily pain, general functioning, vitality, social functioning, and mental health. So overall, seemed like it doesn't help everyone, but might have a good effect. So I started using it with my endometriosis patients, and we started seeing similar things to the research. So it didn't help everybody, but we saw some reduction in pain, even some elimination of certain pains, as most people with endometriosis experience. There's a bit of a smorgasbord of pain that every person experiences, different types, different places, different qualities. And so these techniques were able to eliminate some of them, obviously not eliminating all the pain, but some of them. And then got improvements in bowel function. That one feels logical. We're massaging the digestive organs. The one that surprised me, though, was the vitality component. Many patients reported increases in energy levels, such that if they weren't able to exercise before, they were able to exercise after. If they weren't playing active with their kiddos before, they became active with their kiddos after, or even just having more energy going up and down stairs. But I thought about it, and visceral manipulation is by no means a cure for endo, right? Well, we don't have one, but it's definitely not. But the changes in quality of life were significant that she wished she'd known about it sooner. So that has led me to reaching out to you today.
I'm so grateful that you reached out to me, and I want to get to an understanding is what exactly it means, visceral manipulation. I think I have an idea, but I want to dive deeper into it. But before we get into that, what interested you into learning this technique?
I was in a course. It was actually a pelvic floor treatment course on bowel, and the instructor was was highly trained in visceral manipulation, and she demonstrated some techniques, and my mind was just blown that you could palpate the organs, that you could assess their mobility, that you could improve their mobility. And so just out of pure curiosity, I signed up for that first course and was blown away.
And you've been rolling with it ever since, and seeing results, which I'm sure is very motivating to you, is to see people who are really struggling. And like you said, not everyone, and it's not a cure, but even if it helps to reduce pain and vitality, we all can use more vitality. You and I are both talking about being tired right now. Okay, so what exactly does it mean to do it? And can you do it on yourself? Does you have to have someone do it to you? What does it all mean, and what actually goes into it?
Yeah. So the assessment would be a hands-on assessment of the abdomen, and a trained practitioner can feel that, when you press into your abdomen, there should be some normal elasticity, buoyancy of the organs, and they should all kind of give in and then rebound. But when there is restriction, it might feel either like it won't do that, or it might rebound really firmly. If you think about, I always think about rubber bands in these scenarios. A normal healthy abdomen is more like a thin bit of TheraBand. Do people know what TheraBands are? That's a really common PT tool, but maybe not everyone does.
It maybe not, but if I'm trying to think of something that would be like a TheraBand, any type of, like a rubber band, I think is still like a really thin rubber band that's like worn out.
Yeah. So a rubber band, should stretch easily, stretch pretty uniformly, and stretch and rebound, right? But if there is a restriction, sometimes that rubber band gets really pulled taut in one area. So then when you go to stretch it, go to pull on it, it might not stretch as well, and it'll rebound really tightly. So you can start to map where there is restriction, and then you can palpate organs specifically and assess their mobility. Does it move left to right? Does it move up and down? Does it rotate? All those functions that it might have to do.
That's really interesting. So when you find that it seems like it's restricted or it doesn't bounce back, then what do you do?
Then you do specific techniques. So not to dive too far into the weeds here, but in that example, so with a stuck rubber band, right, you might gently pull on it to free it up and get more motion. And that would, we would call that treating it directly, meaning you're pulling it into the motion it won't do. But because it is tissue inside the body, sometimes slacking the rubber band, if tissue is pulled taut, there might be a lack of blood flow in the area. So if you slack and create more space, sometimes tissues might rehydrate or respond in some way that allows them then to regain that elasticity. We would call that treating it indirectly.
Got it. And obviously for a lot of patients who are listening, and myself included, the thought of someone like pressing around on my abdomen is quite scary, I would say, just because of so many years of pain. And I've heard you mention the word gentle multiple times, which made me feel like, okay, like gentle makes me feel a little bit better. So this isn't like a deep tissue massage. This isn't like working into it. This is, slowly, gently working on the areas.
But I want to talk about adhesions first and then talk about treatment of them. So
Okay.
adhesions have a spectrum. For anyone who doesn't know, an adhesion is when two bodily structures stick together that shouldn't. And an adhesion, if it's mature, so it's been there a long time, it's fully developed, that adhesion, probably the only way to deal with it is surgical, right? It's too strong. And sometimes adhesions are stronger than the organs they're attached to, right? So that adhesion is not something we're going to do much with. But there is a spectrum to get there, right? And so adhesions, when they are first formed, are flimsy and thin, and those we can probably do a lot with. There was a study done in a rat model so that they could open up and look at what happened inside.
Mm-hmm.
And it showed that organ massage or visceral manipulation could prevent the formation of adhesions after surgery and lyse those adhesions. Now, that's a rat model, so we can't directly apply it to humans, but I think it shows potential.
That's great. I mean, that's great news, because that would be such a great thing after surgery, because I'm sure other people listening, like, the surgery definitely has helped me. Excision surgery has helped me, but I do feel like, because I've had so many, I can almost feel the pulling, and I can only assume it's adhesions. And I can feel like I feel like sometimes it's pulling me over. And if maybe I could have had some sort of treatment or this, organ massage, visceral massage after, that would have really helped, right?
I can't say definitively, but obviously I'm biased to thinking it can help. And along those lines, part of the reason I'm so passionate about this for patients with endometriosis, so endometriosis is like a sticky disease in and of itself. The disease itself can cause adhesions and it's at really high rates or percentages of people with confirmed endo also have adhesions. But that's a lifelong concern, right? Because endo is a lifelong disease. Mm-hmm. Then we add surgery, right? So then many people with endo have also had pelvic and or abdominal surgery. And surgery in and of itself has high risk for adhesion formation after. And that risk continues for years after surgery. Mm-hmm. So now we have two sources of risk for loss of organ mobility. And I do think that these gentle massage techniques could be a solution for that.
Now, are these techniques something that patients can do on themselves once they are taught them?
I believe so. Yes. You just would want good instruction.
Yeah, for sure. Because you don't want to just be poking around, not really knowing what you're doing. There's obviously a technique that goes along with it, but it is something that, eventually a patient could potentially maybe learn from someone like you or someone else who may do this, and they can kind of work on themselves. Now, again, I keep thinking back of like someone pressing on my abdomen. I don't know if I would be ready for that. Are there other ways, maybe if you're nervous in the beginning, to start off with, maybe like if, you were performing it or another person who does this, is there another way to start, like foam roller or something that maybe some patients might feel more comfortable with, slowly kind of getting into actually having someone physically work on their abdomen? Or again, we keep seeing abdomen, but like, I know I've had like a adhesion that went up into my shoulder from some of my surgery. So really anywhere on the body.
Yeah. So a couple points on that. So first of all, when you think about organ anatomy, I think people think of, oh, I got to dive deep to get to that tissue.
Mm-hmm.
But the truth is, one of the most common places for adhesions in endometriosis is the peritoneum, which is the sac in which the organs, most of the abdominal organs live.
Mm-hmm.
And that is accessed somewhat shallowly at the front of the abdomen. So when I'm working with a patient, we're not pushing through to get to something. We're dealing with restrictions at each layer and making our way in at the rate that the body can open up. So I hear you on being pushed in. I had in high school, I had this hip injury, and they would always release my psoas, but the psoas is along the front of the spine. So they were shoving in there all the time.
Yeah. Ow.
I have really bad memories of that. So I feel you.
Sure. Yeah.
So that's not what it is, right?
Yeah.
The tissues you might push through are as important to work with, right? And I very often try to start on those superficial tissues and just work at the body's pace going in.
Yeah.
And then as far as could you even just address other tissues before even getting to the pelvis and abdomen? Absolutely. Like you just mentioned, a foam roller or a ball or anything like that would be great self-massage techniques. And to open up, especially when dealing with the pelvis or pelvic floor dysfunction, helping, the quads and the adductors and the hamstrings all get those moving better, that can really open up things so that the pelvis feels more open, even if it might not be so much.
Right. Yeah. I honestly really love foam rolling. Has helped me so much. And I also have something else, yoga balls. They're not like a lacrosse ball. Lacrosse ball, I think, is very intense.
Yeah.
But that I've used, and again, not specifically for endo, but I do get, it actually probably is all related, but I have a lot of hip pain. And so I'll use it in the back of my hip and the front of my hip. And I do feel like it helps, but I can do it at a pace that isn't scary to me because I probably do have a little bit of, trauma from having so much pain in those areas that I'm always very cautious and working with those areas. So, yeah, I'm sure you probably do you have videos or a YouTube channel or something where people could maybe see some tips and tricks if they were willing to maybe try and start using a foam roller or a ball or something?
I don't know if you were on my social media, but I just posted this week, I'm doing a series on foam rolling techniques.
Oh,
that's funny. But yeah.
Yeah, I'm a huge fan of the foam roller. It's one of my favorite tools for sure, just for my whole entire body. But yeah, I definitely feel very tight personally. Okay, well, good.
Can we talk about risks? I just don't want
Yes,
to get through and not
of
get there.
course. Yeah.
Okay, so I talked about those studies not having adverse effects, but those studies were, prospectively designed. We're going to have a trained clinician treat a group of people, etc. So none of those studies, they only had fatigue as an adverse effect.
Okay.
But there are 2 case studies, and there might be more in the literature. I don't claim to know all the literature, but I found 2 in the literature where people showed up basically to an ER with injury, organ injury. One was from receiving treatment done by a practitioner, and one was someone having harmed their own self.
Okay.
And in both instances, the description of the techniques performed were described with having been performed by force. So I just want to be clear that, you can harm your organs getting on them. Someone else can harm your organs by getting on them, especially if it's done with force. So it's not without risk, but that is why I'm so on gentleness.
When patients see you, and I want to get into how you do that, but specifically maybe in person or online or telehealth, how often do you see them?
Usually average once a week. And part of that is when you're working with the organs, there's there's a lot of nervous tissue around them, especially in the abdominal organs, right? There's the vagus nerve is wandering through there, right?
Yeah.
So when we make a change, the body and proprioception and the nervous system really has to process all of that change. And so we don't want to do too much too fast. I know even some practitioners will treat once a month, allowing the body far more time to process.
Okay. That's good information. Yeah. And
I just find it so relaxing. So it's part of my self-care.
Okay. What else do we need to know about this manipulation? Or, patients may be feeling, again, like I said, skeptical or nervous, and we've talked about it being gentle, and obviously there are risks and people need to know that, and you definitely need to make sure you're working with someone who is trained and educated on exactly how to do this. But is there anything that we're missing or not talking about?
Yeah, I would say, so sometimes I talk to people who have been to pelvic floor PT and did not receive visceral manipulation. So I just want to talk about that a little bit. Pelvic floor PT generally is assessing those pelvic floor muscles and how they are responding, and then using kind of orthopedic PT treatment to get any dysfunctions addressed. So many pelvic floor PTs do visceral manipulation, but some don't.
Okay.
And then some folks who do visceral manipulation are not trained in pelvic floor PT, and so they might just be generalist practitioners. So I just want to clarify that those two are not always connected in practice.
Okay.
And then as far as the practice of visceral manipulation itself, I would also say, and very similar to surgeons with endometriosis, training matters. And there is a difference, if a practitioner has had one class in visceral manipulation versus 10, right? That it makes a difference. So if you've had treatment and weren't satisfied or felt like it was too forceful, I would just encourage folks to try elsewhere and see if you had a bad experience.
Yeah, see if it works better. And then I noticed on your website too, you talk about IBS, and I know there's a lot of crossover between endo and IBS, or is it really endo? Those are still questions that are up in the air. But I know many people I talk to, and this is where I was like kind of laughing about things that have been said on the podcast, because we talk about poop all the time on the podcast, and
I'm here for
we've
it.
gotten even more into detail about all of that. But for patients who may be struggling with pain, but then also struggling with the what I would say would be the circle of, maybe it's IBS, maybe it's endo, we don't know, but the constipation to diarrhea to nausea to indigestion, like just the full gut spectrum that can come with endo. Do you work with those types of patients too? And do you use a different type of technique? And what type of success have you seen with that? Have you been able to help to get people's kind of stomachs feeling a little bit better as well? Really bowels,
Yes.
but stomach, feels like it's, your stomach that feels upset.
The short answer is yes, I do work with those folks. And I just want to zoom out a little bit, because bowel, I find, is incredibly complex and multifactorial. So this question you ask of kind of this overlap of endo and IBS, I just want to comment that in terms of the visceral manipulation approach to that, have seen a number of folks with IBS who had decreased mobility of specifically small intestines. And that's an anecdote that I have noticed in my clinic. I've never seen published research on this. But that's a pattern I've seen pretty consistently, not 100% consistent. And when we get that specific tissue able to move better, a lot of those symptoms, specifically of like the visceral hypersensitivity that goes along with IBS, I see improve quite a bit. Now, bowel is far more than that, right? For example, pelvic floor dysfunction, which also will often manifest in the presence of endometriosis and all of the pelvic and abdominal pain with that. So when those muscles become dysfunctional, you can develop outlet dysfunction, meaning the pelvic floor muscles won't relax to let stool come out. So in that instance, pelvic floor treatment is really, really important.
Yeah.
When we talk about endobelly, there is also this concept of like diaphragm mediated bloating. That diagnosis is called abdominophrenic dyssynergia. And it's basically that the diaphragm, when folks eat, the diaphragm in a healthy individual should just stretch and relax and create more space for that food. But in folks with abdominophrenic dyssynergia, the diaphragm will tighten and get short and it'll pull down. And the diaphragm, is up under your ribs. And so if it pulls down, that pressure has to go somewhere. So it forces the abdomen outward, right? And so it can manifest as this very pregnant, full looking belly. So endobelly, obviously there's other, there might be dietary factors, there might be other things to deal with, and there might be muscle dysfunction to deal with as well. Then we get into just food, right? Food absolutely affects bowel, and lots of folks with IBS and with endo have food sensitivity or irritability. But the general formula is you need water and fiber and a well-balanced diet, and then some movement, and that will hopefully get things moving at the right pace through the system. Right? Diarrhea is it's moving too fast, and constipation is it's moving too slow. So we want all the right factors in a balanced way to get things moving at the appropriate speed.
That's a really interesting explanation for endobelly I've never heard that makes so much logical sense. Yes, thank you. I mean, I've had it so bad where it's just the pain of the distension itself is so painful. Like it's hard to even describe. I mean, obviously a lot of people on the show or who are listening on the show and who've been in the show understand like that pain it's awful. And I think the hardest part for myself and other patients is some weeks you could eat XYZ and have no problems. Eggs is a great example for me. But then on other weeks, like if it's around my cycle or ovulation or something, I will get the endobelly, even though I wouldn't get it in other weeks. And it's just it's so confusing. What do you do? What do you do?
Yeah.
And so, well, tell us, how do patients find you? Or, I know you said you're in Ohio, so do you have a clinic there? Can you help people online? Do you do telehealth? Tell us how we can get access to your wonderful work.
Yeah. So if you want to see me, you've got to come to Columbus, Ohio. But otherwise, actually, after that patient called me out that we talked about earlier, I started my own online health coaching business called Nourish Meditation, and you can find that at nourishmeditation.com. I'm also on Instagram, handle Nourish Meditation, and TikTok, Nourish Meditation. And I coach people in how to perform self-massage. So not a PT evaluation, but just coaching on how to use these tools for your benefit.
Good. That's great. That's very, very helpful for people. And if people are thinking of reaching out to you, is your website the best way to go? We'll link everything in the show notes, everybody. But yeah, website's probably the best way to get in contact with you. And
Yep.
I'm sure there's going to be a lot of questions that people will have that I didn't think of. Is there anything else we didn't discuss or you want to chat before we wrap up?
Not that I can think of, but I'm happy to answer any questions.
Okay, good. Well, I'm sure some people have questions, but I appreciate you coming on and talking about this, but also thank your patient for calling you out, because if this can help some people alleviate at least some pain, it's always worth trying to. I know there's so many different modalities that people try with endometriosis, like I've done acupuncture, I've done cupping. I did see you talk about cupping a little bit on your Instagram. And, if people want to know more about that, they can check out your Instagram. But just there's a lot of methods, I think, maybe before, after surgery, to just help mitigate some of the pain that people with endometriosis really struggle with. So I appreciate you coming on and talking about this and building our awareness. I mean, honestly, I've heard of different types of techniques, but I haven't heard of this. So this was very interesting to me. And I'm thinking about my hip pain right now that's hurting. And I was like, maybe I need to do some of this. So I really, really appreciate the time and the education. Dr. Maggie, thank you so much.
Thank you. And thank you for having this podcast. It's a great resource.
Thank you so much. I appreciate it. Thank you everyone so much for listening and being here. I really appreciate it. I hope this show was helpful for you, and learning something new definitely was for me. If this show provides you any value, please leave us a 5-star review anywhere you listen to your podcasts. And I hope you're feeling okay today. Thank you again so much for being here and listening.